Virtual hospitals using augmented reality technologies are a relatively new concept that aims to provide medical services remotely using technology. The idea is to use augmented reality to create a virtual environment that replicates the experience of being in a physical hospital, while allowing patients to receive medical treatment from the comfort of their own homes. Advantages: increased accessibility. Virtual hospitals using augmented reality technology can make medical services more accessible to people who live in remote or underserved areas. For example, a patient in a rural area who would otherwise have to travel several hours to see a specialist can now have a virtual consultation with a specialist using augmented reality technology. Reduced costs. Virtual hospitals can reduce costs associated with travel and accommodation for patients and their families, as well as the cost of maintaining physical hospital facilities. For example, a virtual hospital can save money on the cost of maintaining and staffing physical facilities, and patients can save money on transportation and lodging expenses. Increased efficiency. Virtual hospitals can increase the efficiency of medical services by reducing wait times and allowing patients to receive treatment more quickly. For example, a virtual hospital can schedule virtual consultations with multiple specialists in one day, instead of having the patient travel to see each specialist individually. Remote monitoring. Augmented reality technology can be used to remotely monitor patients' condition, allowing medical professionals to quickly identify and address any issues. For example, a patient with a chronic condition such as diabetes can use augmented reality technology to monitor their blood sugar levels and transmit the results to their doctor, who can then adjust their treatment plan accordingly. Virtual rehabilitation. Augmented reality technology can be used to provide virtual rehabilitation for patients recovering from injury or surgery, allowing them to perform exercises and receive guidance from a therapist remotely. For example, a patient recovering from a knee surgery can use augmented reality technology to perform physical therapy exercises at home, with virtual guidance from a therapist. Virtual reality for mental health treatment. Virtual reality and augmented reality can be used for psychological treatments for conditions such as PTSD, phobia, and depression. For example, a patient with a fear of heights can use augmented reality technology to safely expose themselves to virtual heights and work on desensitization. Disadvantages: limited interaction. Virtual hospitals using augmented reality technology may not provide the same level of interaction and personalization as a physical hospital. For example, a virtual consultation may not be able to provide the same level of empathy and understanding as a face-to-face consultation. Potential for technical difficulties. Virtual hospitals may be subject to technical difficulties, such as connectivity issues or equipment malfunctions, which can disrupt the delivery of medical services. For example, a virtual consultation may be interrupted by poor internet connection, leading to an incomplete consultation. Limited to certain specialties. Virtual hospitals may not be able to provide certain types of medical services, such as surgeries and certain diagnostic procedures. For example, a virtual hospital may not be able to provide certain diagnostic procedures such as X-rays or MRI scans, and surgeries that require a physical examination or hands-on approach can't be performed virtually. Potential for privacy and security concerns. Virtual hospitals may be vulnerable to privacy and security breaches, which could compromise patient data and personal information. For example, a hacker may be able to access patients' personal information and medical records if the virtual hospital's security system is compromised. Cost of equipment. The cost of the necessary equipment, such as VR or augmented reality headsets, can be prohibitive for some patients and hospitals. For example, a hospital may not be able to afford to purchase the necessary equipment for all its patients, limiting the accessibility of virtual hospital services to only a small portion of patients. It's important to note that these examples are not exhaustive and that the advantages and disadvantages of virtual hospitals using augmented reality technology may vary depending on the specific implementation and context.